Welcome to my channel. For your health, please don't forget to click to subscribe. As you get older, should sex really become a forgotten need? When you are in your 60s, 70s, or even 80s, have you ever asked yourself in the dead of night, at this age can I still have sex? When people around you assume that old people should be pure and abstinent. And when your children accidentally see you and your partner being intimate and embarrassed, do you also begin to doubt whether sexual needs really belong only to young people? In fact, the latest survey data from the American Society of Sexology shows that among people aged 60 to 80, 40 of men and 17 of women still maintain regular sexual activities. This means that 4 out of every 10 elderly people are proving with their actions that sexual needs are a natural instinct that accompanies people throughout their lives, and it will not completely disappear due to the increase of white hair and the deepening of wrinkles. But it is undeniable that with age, the decline of body functions is like the quietly changing for seasons, so that the sex life of the elderly needs a more scientific dressing guide. Neither deliberately cold-resistant, due to traditional prejudice, nor blindly advance by ignoring physiological changes. Next, as a physician who has been engaged in clinical work in geriatric medicine for more than 20 years, I will dismantle all the sex life from a medical perspective, so that you can protect your health while enjoying intimacy. In the outpatient clinic, I often encounter such scenes. 70-year-old Mr. Zhang holds his wife's hand, blushes to his ears, and says after a long time, "Doctor, I still think about this at this age. Is it abnormal?" Similar confusion is essentially due to the public's cognitive bias on the physiology. Many people mistakenly believe that men should be no longer vigorous after the age of 60, and women should be desireless after menopause. But the mystery of the human body is far more tenacious than imagined. From a physiological perspective, male testicles are like tireless hormone factories. Even at the age of 80, they can continue to secrete testosterone. But the amount of secretion is about 30 less than that in youth. This hormone not only maintains sexual desire, but also silently protects bone density, muscle strength, and emotional stability. A study tracked 200 men over the age of 60 and found that people with regular sex life had testosterone levels about 20 higher than those who suppressed their needs, which was directly related to their energy state and stress resistance. The female body also hides a mystery. Despite the decline of ovarian function, the adrenal glands and adipose tissue will still synthesize a small amount of estrogen to maintain the basic health of the vaginal mucosa. More importantly, the essence of sexual demand is not only a physiological impulse, but also an instinctive call from the limbic system emotional center of the brain. I once treated a 72-year-old lady named Lee, who confessed, "Holding hands and hugging my spouse makes me feel warmer than taking any tonic." This is because intimate behavior can cause the brain to release oxytocin, a hug hormone, that can instantly narrow the psychological distance between people and relieve loneliness. Gentle massage. For cardiovascular, a moderate intensity sex life is equivalent to the amount of exercise of walking up to floors, which can increase the heart rate to 90 to 110 beats per minute and promote blood circulation throughout the body. A study by Harvard University in the United States shows that the risk of coronary heart disease in the elderly who maintain 1 to 2 sexual activities per week is about 25 lower than that of those who rarely have sexual activities. Natural antidepressant for emotions during orgasm, the brain will secrete a large amount of endorphins, which have an analgesic effect equivalent to 1/5 of morphine, and can also offset the negative effects of cortisol stress hormone. I once treated Mr. Wang, who was depressed due to the death of his spouse. With the understanding and support of his children, he met his needs in a reasonable way, and his sleep quality improved. And the dosage of antidepressants was reduced by half. Invisible enhancer of the immune system. experiments at the University of Nottingham in the UK found that the level of immunoglobulin IgA in the body of elderly people with regular sex life is 30 higher than that of their peers. This antibody is the first line of defense of human mucosal immunity and can effectively resist respiratory and urogenitally tract infections. Last year, a special mother and son came to the clinic. The 50-year-old son pulled his 70-year-old father and said angrily, "Doctor, please talk to him. It's shameful to watch those things at such an old age." The old father lowered his head and rubbed the corner of his clothes nervously. Similar scenes are not isolated cases. Many children equate their parents' sexual needs with old and improper, but ignore a basic fact: the emotional needs of the elderly are the same as those of young people, and they need to be seen and respected. Use data to break prejudice. You can try to show your children this set of data. In Japan, the number of sexual health consultations for people over 60 years old is growing at a rate of 15 per year. A survey in the United States shows that more than 80% of elderly couples believe that intimate behavior is a key factor in maintaining the quality of marriage. Use analogies to resolve embarrassment. It is better to use this analogy. Just like eating when hungry and drinking water when thirsty, sexual needs are also normal needs of the body. We old couples take care of each other, which is actually the same as your love for each other. Use cases to guide understanding. Share stories around you. Your Uncle Jean and Aunt Lee have been married for 50 years. Now they still walk hand in hand every day. They have a good relationship. This is good for their health and mood. Many people mistakenly believe that sexually transmitted diseases are the patent of young people, but a set of shocking data is rewriting cognition. The 2023 report of the National Center for Disease Control and Prevention shows that the number of male HIV-infected people over 60 in my country has tripled compared with 10 years ago. And the incidence of traditional STDs, such as syphilis and gonorrhea, in the elderly population has also been increasing year by year. There are two key reasons behind this. First, the elderly generally lack awareness of protection, thinking that you won't get pregnant when you're old, so you don't need to wear a condom. Second, as life expectancy increases, the sexually active period of the elderly is also extending, while the body's immunity is declining, resulting in a doubling of the risk of infection. The triple protection of condoms: prevent disease transmission. High-quality condoms can block 99 of sexually transmitted disease pathogens, including HIV, Treponema-Pallidum, HPV, etc. Prevent mucosal damage. Elderly women have dry vaginas, and the lubricant on condoms can reduce friction damage, which is more hygienic than simply using saliva. Prevent psychological burden. Avoid the anxiety of whether you will be infected afterwards, making the intimate experience purer. 5 key points for using condoms correctly. Choose size. Asian men are on average suitable for medium size, about 52 y, which is easy to fall off if it is too large, and easy to break if it is too small. You can use a household tape measure to measure the circumference of the middle of the penis after erection, and then choose according to the product's size chart. Check the expiration date. The shelf life of condoms is usually 3 to 5 years. The latex of expired products will become brittle. Be sure to check the production date and expiration date on the package before use. Squeeze out the air. When wearing, pinch the small sac at the front with your fingers to squeeze out the air to avoid rupture due to excessive pressure after ejaculation. Wear it all the time. Many people mistakenly believe that you don't need to wear it during foreplay. But in fact, men's precum prostatic fluid may contain a small amount of sperm and pathogens, and it must be worn from the beginning of erection. Steady removal. After ejaculation, press the base of the condom in time and withdraw it with the penis to avoid semen spillage or condom slippage. Special needs for women. Scientific response plan for vaginal dryness after menopause. Analysis of physiological mechanism. After menopause, the estrogen secreted by the ovaries of women drops sharply, resulting in thinning of the vaginal mucosa, fewer wrinkles, and insufficient secretions. This condition is called atrophic vaginitis. Data shows that about 70% of postmenopause women will experience varying degrees of vaginal dryness, and 20% of them are forced to give up sex. Basic care: choose medical-grade water-soluble lubricants, such as Kainstein and Dorx lubricants, and avoid oily lubricants, such as Vaseline, as they will damage the material of condoms. Apply a pea-sized amount to the vaginal opening and the surface of the condom to effectively reduce friction. Medical intervention: use local estrogen preparations such as estriol ointment under the guidance of a doctor to directly act on the vaginal mucosa and improve cell vitality. Note: it is prohibited for patients with breast cancer and endometrial cancer. Lifestyle adjustment: eat more foods rich in phytoestrogens, such as soy milk, tofu, and flax seeds. Wash the vulva with warm water every day, and avoid using soap, shower gel and other irritating items. Be alert to abnormal signals. If you experience persistent vaginal pain, a small amount of bleeding, or odorous secretions after sexual intercourse, it may be a tear or infection of the vaginal mucosa, and you need to go to the gynecology department for treatment in time. I once met a 66-year-old aunt who delayed medical treatment because of shyness. As a result, vaginal tearing caused pelvic infection, and the treatment process was much more complicated than early intervention. The aging code of body functions: compared with 30-year-olds, the muscle strength of 60-year-old men decreases by about 30, and the heart ejection function decreases by about 20, which means that the sex life of the elderly needs to abandon the sprint mode of young people. There was a clinical case. A 65-year-old man imitated the violent movements of young people, resulting in a strain of waist muscles, and he was bedridden for 2 weeks before recovering. 3-3 system, intensity principle. Time control: it is recommended to control the duration of a single sexual life to 10 to 15 minutes, and avoid more than 20 minutes. If you are physically exhausted, you can do it in stages. Rest for 3 to 5 minutes in between, and drink some warm water. Taboo position reminder: woman on top. It requires high waist and abdominal strength for women, and it is difficult for men to control the rhythm, which may cause muscle strain in women. Standing position: it is easy to fall due to unstable center of gravity, especially for women with osteoporosis. Legs raised: it will increase abdominal pressure and may induce hernia or urinary incontinence, common in the elderly. The secret of circadian rhythm: the human body's blood pressure and heart rate are at their peak in the early morning, 6 to 8 o'clock. If you have sex at this time, the risk of cardiovascular and cerebrovascular accidents is about 30 higher than other periods. From to p.m. to 16 p.m., the body temperature and hormone levels are relatively stable, and the energy is relatively abundant. From 17 p.m. to 19 p.m., the testosterone level rises slightly, and it is easier to have sexual impulses. Avoid special scenarios. After a full meal, gastrointestinal congestion will divert blood from the sexual organs, which may cause male erectile dysfunction and reduced vaginal secretions in women. It is recommended to have sex 2 hours after a meal. After drinking, alcohol will inhibit the sexual excitement center and may also cause blood pressure fluctuations, especially for elderly people who drink for a long time. The liver's ability to detoxify alcohol is reduced, and the risk is higher. When emotionally excited after a quarrel, when overexcited or sad, adrenaline secretion increases, and sex at this time may induce palpitations and dizziness. 3 major assessments before medication. Cardiovascular function: although PDE5 inhibitors, such as Sildenafil Viagra and Tadalafil, can improve erections, they may cause a slight drop in blood pressure. Therefore, elderly people with severe coronary heart disease, unstable angina, and blood pressure higher than 110 Mmhg need to be evaluated by a cardiologist first. Drug interactions. Elderly people who are taking nitrate drugs, such as nitroglycerin indices or bigmanonitrate, are absolutely prohibited from using PDE5 inhibitors. The combination of the two may cause blood pressure to drop sharply to shock levels. Liver and kidney function. The liver and kidney metabolic capacity of the elderly is reduced. It is recommended to start with the lowest dose, such as 25 mg of sildenafil, and gradually adjust according to the effect intolerance, with a maximum of no more than 50 mg time. Common side effects and responses. Headache, facial flushing. About 10 of users will experience it, usually mild, and can be relieved by drinking more water. Visual abnormalities, rare, manifested as blue vision, if it lasts for more than 1 hour. The drug should be discontinued and medical treatment should be sought. Erection lasts for more than 4 hours, see a doctor immediately. This may be a rare but serious, abnormal erection. Delayed treatment may cause permanent damage to the penis. People with high blood pressure. Measure blood pressure before sex. If it is higher than 160/100 Hg, it is recommended to take medicine to lower blood pressure first and then have sex 2 hours later. Avoid holding your breath and exerting force such as defecation, to avoid inducing a sudden increase in blood pressure. Choose a side-lying position to reduce the burden on the heart. Sit quietly for 5 minutes before getting up. Patients with coronary heart disease. Carry nitroglycerin with you. If you feel chest tightness or chest pain during sex, take a tablet sublingual, lie immediately and stop the activity. Avoid doing it in a cold environment, because low temperature will cause blood vessels to contract and increase the burden on the heart. Within 3 months after myocardial infarction, it is necessary to be evaluated by a cardiac rehabilitation doctor before deciding whether to resume sexual life. Patients with diabetes. Control blood sugar below 7.0 mol when fasting and below 10.0 mol after meals to avoid fatigue and dizziness caused by blood sugar fluctuations. Pay special attention to foot and genital hygiene. Diabetic patients have low immunity, and even minor damage may cause infection. If neuropathy has occurred, such as decreased genital sensation, it is necessary to reduce the intensity of sexual life to avoid damage caused by dull sensation. Arthritis patients. Take non-steroid anti-inflammatory drugs such as ibuprofen half an hour in advance to relieve joint pain, but pay attention to gastric mucosal protection. Choose a posture that puts less pressure on the joints, such as sitting, and pat the joints if necessary. Avoid excessive flexion or extension of the affected joints. For example, patients with knee osteoarthritis should avoid kneeling. Common psychological disorders in men. Anxiety caused by decreased erectile hardness. About 60 of men over 60 will experience slower erection speed and reduced hardness. Some people refuse to have sex because of this, and fall into a vicious cycle of, the more anxious, the worse it is. There was a 65-year-old Mr. Chen who avoided intimacy with his wife for a whole year due to an accidental erectile failure. Finally, under the guidance of a sex therapist, he gradually regained his confidence through cognitive behavioral therapy. Loss of reduced ejaculation pleasure. The ejaculation distance and volume of elderly men are shortened, which is a normal physiological phenomenon, but many people equate it with loss of sexual ability. It needs to be made clear that the core of sexual life is emotional communication, not simply the pursuit of physical pleasure. Common psychological disorders in women. Body image inferiority. Vaginal atrophy and sagging breasts after menopause make many women feel unattractive. I once suggested to a 72-year-old Aunt Liu that she and her husband look through their wedding photos when they were young and recall the sweet moments. This emotional connection can effectively dilute the attention to physical changes. Sexual demand shame. Influenced by the concept of old women have no sex, some women dare not express their needs even if they have them. You can try this kind of communication. My dear, I feel that we can watch TV and hug together recently, and my heart is warm. What do you think? Deliver your needs in a gentle way. For steps of nonviolent communication. Observation: I noticed that you hold my hand when we watch TV together at night recently. Describe facts, not comments. Feelings: I feel very warm, as if I'm back to when I first got married. Express your emotions. Demands: I hope we can have more intimate contact like this. What do you think? Clearly state the needs, not commands. Request: if we take a shower on weekend nights and chat together on the sofa, I will be very happy. Specific and actionable suggestions. Wisdom of dealing with rejection. When your partner says, "I'm not in the mood," avoid asking, "Do you not love me anymore?" You can respond, "It doesn't matter, are you too tired recently? Then let's hug and talk today." This accepting attitude can reduce the other person's pressure and create opportunities for intimacy. Next time. 3 questions for self-acceptance. Do I allow myself to still have emotional needs in my old age? Am I afraid of what others think? Or do I really not need intimacy? If I look back at myself 10 years later, will I regret suppressing my needs? Suggestions for safely rebuilding intimacy. Start with physical contact. Holding hands, hugging, kissing and other non-sexual intimate contact can gradually build intimacy, especially for new partners. Be honest about your health status. New partners should explain their chronic diseases and medication in advance to avoid embarrassment and make the other party understand your needs better. Choose a professional platform to make friends. Meeting your partner through a formal elderly marriage agency, or AP, is safer than meeting on the street, and it also reduces the pressure of social prejudice. Lumbar muscle strain. Stop activity immediately. Lie down undressed. Apply cold compress within 24 hours 15 minutes each time, 1 hour apart. Apply hot compress after 24 hours and apply ulcer ointment. If the pain persists for more than 3 days, you need to see a doctor to check for lumbar spine problems. Vaginal tear bleeding. When there is a small amount of bleeding, use clean gauze to compress and stop bleeding, and suspend sexual intercourse for 2 weeks. If the bleeding is heavy more than the amount of menstruation or continues, go to the gynecological emergency department immediately. Penile foreskin incarceration. It is more common in people with excessive foreskin, and the foreskin cannot be reset after turning up, and the head of the penis is swollen. Immediately hold the penis with your hand and push it towards the foreskin. If it cannot be reset, go to the urology department within 1 hour to avoid ischemic necrosis. Cardiovascular accident warning. Premonitory identification: compression pain behind the sternum, radiating pain in the left shoulder, dizziness, and difficulty breathing during sex may be a precursor to angina pectoris or stroke. Emergency measures. Stop the activity immediately, take a semi-recumbent or sitting position, and keep the airway open. Those with a history of coronary heart disease take nitroglycerin sublingual or Bidin for those with low blood pressure. Call 120 and tell the doctor. Chest pain, dizziness during sex, to facilitate emergency personnel to prepare in advance. Men do prostate-specific antigen PSA testing and testosterone level testing every year, and do a male ultrasound every 2 years to check for prostate hyperplasia, varicocele and other problems. Women do a gynecological examination, routine Luke or RIA, HPV and TCT screening every year, and do a vaginal ultrasound every 3 years after menopause to monitor the thickness of the endometrium. Lifestyle optimization. Exercise prescription. Aerobic exercise such as brisk walking, swimming 3 times a week, 30 minutes each time, can improve blood vessel elasticity and enhance sexual activity endurance. Do 10 minutes of Kegel exercises and IS training every day to strengthen the pelvic floor muscle strength. Diet conditioning. Eat more foods rich in zinc such as oysters, lean meat, nuts. Zinc is essential for male testosterone synthesis. Women eat more foods rich in vitamin B2 such as milk, eggs, spinach, which can relieve vaginal dryness. Sleep management. Ensure 7 to 8 hours of sleep a day. Lack of sleep can cause testosterone levels to drop by about 15, affecting sexual desire. Data slaps traditional concepts in the faith. A study by the New England Journal of Medicine in the United States shows that among men over 80 years old, 20 can still maintain regular sex. A survey of Japanese nursing homes found that the incidence of mental illness among the elderly in institutions that provide sexual health consultations is 40 lower than that of those that do not. The power of celebrity role models. Queen Elizabeth, the Queen Mother, the mother of the Queen of England, still publicly stated at the age of 80 that intimate relationships are the spice of life. At the age of 70, the famous Chinese writer Bing Yin wrote in a letter to a reader, "Love knows no age. It is the mutual nourishment of the soul." These frank attitudes are subtly changing social cognition. The right way for children to open. Give health knowledge instead of accusations. When you find that your parents are reading books on sexual health, you can say, "Dad, I saw an article saying that appropriate sex life for the elderly is good for the body. Do you want to read it?" Help parents solve practical problems. When you find that your mother has vaginal dryness, you can quietly buy medical lubricants and attach a note. "Mom, this is recommended by the doctor. Will you feel more comfortable if you try it?" Actively create intimate space. Take grandchildren to the park to play on weekends. Leave time for parents to be alone and express, "I understand your needs," with actions. Avoid communication taboos. Don't say, "You are so old, aren't you ashamed to think about these things?" Don't do, look through your parents' private items without permission. 8. Conclusion. Let every dusk have warmth. When the sunset dyes the sky red, we often think that it is the end of the day, but we ignore that the sunset can also be gorgeous. Just like the sex life of the elderly, it is not a faded reproduction of youthful passion, but a gentle embrace after the precipitation of years. He will still pat her back before going to bed at the age of 70, and she will still smile because of his embrace at the age of 80. As a doctor, I have seen too many elderly people suppress their needs due to misunderstandings, which eventually leads to physical and psychological damage. I have also seen too many couples make intimate relationships a secret weapon to fight aging under scientific management. Please remember, sexual health is not a privilege of young people, but a lifelong life issue. 60, 70, 80 years old. The intimate needs of every age group deserve respect. And every scientifically planned sex life is a deep tribute to life. Finally, a word for all elderly friends. Time can dye white hair, but it cannot freeze the temperature of the soul. The body can slowly age, but the desire for intimacy is always young. May you, under the guidance of science, embrace a quality and dignified old age, and let every evening be warmed by love.